It was your typical British summer afternoon. It was cold, there was rain, even thunderstorms, and along came my last patient to clinic. She was a 43-year-old female, visibly crippled in pain, holding onto her abdomen, urging me to prescribe her opioids just so she could get on with her daily activities. I'll never forget what she said to me. "Doctor, I don't want to waste your time. It's just my period. I'm used to the pain." Please raise your hand if you, at any point, have just got used to the pain or been told to just get on with it. Okay, me too. Pain is defined as an unpleasant sensory or emotional response associated with actual or potential tissue damage. You have acute pain, which is sudden and sharp, or chronic pain that can last for much longer, anywhere between 3 to 6 months, or in the case of my patient, 22 years. In medical school, I was taught that pain is a precursor. It's a sign that there's something wrong in your body and something needs to be fixed. Imagine my shock working as a doctor in the real world, where I come to find that half of society has been conditioned to normalize pain. So good morning. My name's Dr. Veena Babu. I'm a practicing GP, and today I stand here representing that part of society which has for long been treated as an afterthought in the health ecosystem. I believe women's health and their issues aren't just focused on women. I feel that it's a human issue that we all need to echo and vocalize together. For centuries, medicine has had one tiny blind spot: women. The female body has always, globally, during research, been treated as an annoying little footnote. Results may vary based on gender. We all now know that it's a little bit more complex than that. When I say women's health, the first thing that may come to your mind is periods, pregnancy, menopause. All of that is actually under gynecological and reproductive health. What I want to shed light on today is the broad array of general health conditions that women experience, present, and exhibit differently to men. Just a quick top to bottom, some examples: neurology, migraines, endocrine, thyroid abnormalities, cardiovascular health, heart attacks and strokes, gut health, Crohn's and colitis, musculoskeletal, osteoporosis, and the list goes on. Have to mention mental health too: autism, ADHD, and Alzheimer's. These are not things that can be ignored. Let's get into the heart of it. Heart disease is the leading cause of death in women worldwide. Yet, until the late 1990s, majority of heart health research was focused on male subjects. So now I go to the textbook. What are the signs and symptoms of a heart attack? It says left-sided chest pain, left arm pain. Do you know what most women present with? Jaw pain and fatigue. So if you've been told that you're just a little stressed or been overworking, but in fact have had a heart attack, mind the gap. What pains me even more is knowing that 70% of chronic pain is experienced by subjects that are women, yet 80% of research in pain is done on male subjects. Make it make sense, right? I'm not great at math, but even I know when the numbers don't add up. In the UK, between 2009 and 2020, there was a mere 5.8% allocated towards women-focused health initiatives. And it wasn't that great on the other side of the pond either. In the US, in 2020, the US National Institute of Health allocated just 10.8% towards women's health. When you think and know that women make up half or more of society, how does any of this make sense? This oversight has meant that we've missed critical insights in how diseases present in women and how we can narrow this health gap. Men and women are inherently different. We're unique. The way we process information, the way diseases manifest in us, the way medication and drugs respond and react in our bodies are unique. These need to be celebrated. Our uniqueness is what makes us us. It's about time healthcare and society reflects and respects that. We need inclusive and tailored results and solutions. Recent research from the World Economic Forum released data that revealed that there's a potential saving of up to $1 trillion by 2040 if we can close the gender health gap. In addition, we could add, get ready for this, ladies, we could add 500 days in good health to a woman's life. We all know we can do a lot with that time. I know I sure could. The tangible and intangible costs are something I think we need a whole different talk for. We're talking about days lost at work. We're talking about the burden of disease, the surmountable cost psychologically and financially to families. It's not just about the productivity that gets affected, it's thinking about how can we, as a unit, come together to tie in these changes to get to an end result. The data just cannot be ignored. We need to mobilize and make this change happen. Saying things like, it's in your head, get on with it, is dismissive. It suggests to women that being in discomfort is normal. Guess what? It's not normal. It's not normal to be in pain. It's not normal to be bleeding profusely from your menstrual cycle, to be bedridden. It's not normal. It's worth mentioning at this point that the gap is even wider when we focus in on women's specific conditions, such as maternal health, fertility, sexual health, and gynecology. Studies have found that there is a much higher risk of mortality and adverse effects in women from specific ethnic minorities. In the UK alone, Black women have a 4 times increased risk of death during pregnancy, childbirth, and in the postpartum period. And Asian women have twice the risk. The work is cut out for us. The real question is, are you cut out to demand this change? Societal whispers shape ideologies. You may have once heard sitting too close to a TV will affect your vision. It doesn't. It may strain your eyes, but the chances are you're sitting close to the TV because you already have impaired vision. You may have heard too much sugar leads to diabetes. It doesn't. Too much sugar leads to obesity, and obesity is a risk factor for diabetes. One of our favorites, women can handle pain. Women are made for this. Unfortunately, this is not an evolutionary trait, and today we know that this is because of underrepresentation and poor reporting. The gender bias in healthcare is a crisis. I repeat, the gender bias in healthcare is a crisis. We need to study the biology of women. We need to have accurate data so they're represented, so that we can take even a baby step towards equitable healthcare. We need a health revolution, a world where women's symptoms are not trivialized, where they're included in every study that involves their body, where they're not just invited to take a seat at the table, they're invited to help design the room. I have 5 actionable steps that you can take away from this talk. 1, ladies, get to know your bodies. Understand what is normal for you. Your normal might not be someone else's normal, and that's beautiful and that's fine. Understanding this will help you identify when something's there that shouldn't be there. It could be a lump, it could be abnormal bleeding, discomfort during intercourse. These are not symptoms to just be ignored. They could be signs of something much more serious like endometriosis, polycystic ovarian syndrome, or even cancer. The patient I spoke about at the start, turns out she had 2 large 10-centimeter fibroids in her pelvis that needed to be operated on. She's not on opioids, and she is much well now. Number 2, the men in our lives. We need you as allies. We need you to encourage the women that you know, the women that you're related to, that you come across, to speak up for their own health and to advocate for that. We need to mobilize more funds towards research and actual collection of data, specific for female-focused health solutions. This has to come from government bodies, non-profit health organizations, national research funds, and also global initiatives. We need women in leadership, and this has to be across the board. We need this in healthcare, business, venture capital, and government. They need to be in positions where they can actually be the driver of that train of change. And finally, challenge societal norms. If you have a platform, be that professional, personal, creative, use it. Echo some of the points we've spoken about today, because this is our responsibility as a society. When women are accurately represented in research, we will get data. That data is going to help drive innovative solutions. The solutions will incentivize government and private funding organizations to put more money into the research, which will in turn get us more data. Women's health is bound to improve. The ripple effect is unmissable. As women's health improves, the economy thrives, and eventually everybody benefits. So next time you're on the London Underground and you hear that familiar "mind the gap," I urge you all to let it be a powerful reminder that we're done minding the gap. It's time to close the gap. Thank you.